Hello, everyone, and thank you very much for this invitation to share some of my father's thoughts on osteopathy and many other aspects of his work. I have to start the story slightly earlier to give a little bit of a sense of what led him to do all that he did, because really it's a family story. And my father was the fourth in a long line of therapists who each contributed significantly to the development of the work that he then refined and took further. So first in the story is Stanley Leaf, and you may have come across his name in some of my father's books. Stanley emigrated as a child from Latvia to South Africa with his family, and so did my father's family, parents and grandparents. And Stanley was my grandfather's cousin. So my father's second cousin, essentially. So they emigrated to South Africa in the early 1900s, and Stanley was a sickly child, often unwell, very weak. And one day he picked up an American health magazine called Physical Culture. And this was produced by one Bernard McFadden, whose name may still be familiar to many in America, because he was responsible for establishing a whole movement, essentially, of self-care and self-healing in the early 20th century. And Stanley was so inspired by the effect that McFadden's methods had on his own health improvement that he ended up training with him, and he also trained as a chiropractor and a naturopath. And then he later moved to England, served in the First World War, and then in 1925 he established Champneys Hydro, a health centre which Stanley, whose name Stanley essentially made famous through his very positive results with patients using diet, fasting, hydrotherapy, manual therapy, and other natural health methods. And it was in that context, just before or shortly before World War II, that Stanley Leaf began developing neuromuscular techniques, or what became neuromuscular techniques. At some point in the 1930s, a grateful patient donated a building in London to Stanley as a thank you for his work, and that's where he established the British College of Naturopathy and Osteopathy, which is now the British College of Osteopathic Medicine. And he served as dean from 1936 to 1963. That's where my father arrived to study in 1956. Meanwhile, Boris Chaitow, who you see here in the color picture, he was my father's uncle, my grandfather's brother. He abandoned a career in law because he was so inspired by Stanley's work that he actually went off to the States, where he became an osteopath, a naturopath, and a chiropractor, and then went to work with Stanley as his assistant at Champneys before and during World War II, and together they refined and developed neuromuscular techniques further. They were later joined by Peter Leaf, Stanley's son, who you see here, and shortly thereafter, on graduation in 1960, my father joined them as well. And together they worked at Champneys and then later in London, where by his own account, my father was the junior member of the group, and he studied and learned from Stanley and Boris before he went on to establish his own practice. Having qualified in 1960, he was focused very early on, through the influence of the other, his cousins and uncles, on soft tissue techniques, and he refined these over the years. And one of the key points that led him to this focus was his interest in the ideas of general and local adaptation syndrome and the effect of multiple adaptive efforts on the whole organism, the combination of multiple adaptive stresses, the emotional, psychological tensions that they can cause, that can feed into them, and how these patterns and often enough feedback loops become somatized, so that a combination of mental and physical stresses end up causing physical change and dysfunction. So his approach to treatment overall was to attempt to reduce adaptive load by removing, or at least improving, neuromuscular dysfunctions that would thus have this effect. And to do this, he focused on the soft tissue component in much of his work, though this was by no means his only focus. He was very strongly mindful of the whole person approach. And again, this was from the early days, including postural re-education, lifestyle adaptations to reduce stress responses across the spectrum of physiological, emotional, behavioral, and structural factors. And it was through his techniques and specifically his focus on gathering the growing evidence over the years that he demonstrated how this combined approach could often remove the need for more invasive adjustments and manipulations. And I'll say a little more on that later. I know many of you will know him through his books. He began writing in 1976, 1977, and continued quite literally until his last day. And although altogether he wrote over 80 books and textbooks for both practitioners and lay people, his books for the general public were very specifically intended to empower each individual to take an interest in improving their own health. And he was also on a mission which spanned his lifetime to clean up the image of alternative medicine. The idea of self-treatment and self-help really has always been part of naturopathy and osteopathy. And there, from the earliest days, there was a very democratic character in terms of patient empowerment embedded in these professions. So, and for my father, these were key characteristics. He always sought to empower his patients where possible. So his approach to these books for the general reader was to clear out outdated or inaccurate information, and to, above all, avoid the kind of language and claims that sometimes place naturopathic approaches in an antagonistic role against mainstream medicine. But instead, he looked to draw on all available research, aiming to maintain a scientifically sound approach to demonstrate that it was time these professions were taken seriously. And he was never afraid to drop practices or ideas that simply didn't stand up to the evidence, and was always open to learning throughout his lifetime, as those who knew him can also attest. It was also in the late 1970s that he began corresponding with members of the American Osteopathic Association, aiming to open channels of communication to lead to better regulation of the osteopathic profession in the UK and more consistency between American and British recognition and practice, again with the purpose of aligning osteopathic practice more closely with the scientific evidence and tackling misconceptions surrounding the profession. So his work, together with that of others, did eventually lead to a number of positive developments in that direction. And he also wrote many textbooks on a range of topics connected largely to soft tissue work, all of which were designed as practical handbooks that balanced clinical expertise with research evidence and a broad range of potential patient needs to inform an individualized treatment plan. And he was also very keen to build bridges between related professions. So for the majority of his books from the 1990s onwards, he approached colleagues with expertise in specific areas from a range of related professional backgrounds. He would write the chapters that fell within his own area of expertise, while selecting and editing the rest to provide as broad a selection of approaches to a given topic as possible, showing how the techniques and approaches he was presenting were relevant, how they could and why they should be integrated into physiotherapeutic, osteopathic, chiropractic, and massage therapy practices equally effectively. And again, I have some examples from his own presentations on that later. And while he always considered that osteopathic principles provided the ideal whole person approach, he also felt there were very valuable things to be shared between professions and worked towards building such collaborations. Apart from the books, he was from the early 1980s, he was consultant, editor, and then editor-in-chief for a series of journals focused on alternative and complementary medicine, as it was known at the time, where his focus was always on finding and encouraging the best, newest, and most clinically useful research relating to osteopathic and naturopathic practice. In 1996, he founded the Journal of Bodywork and Movement Therapies, JBMT, and ran it right until the end, when I stepped in for a couple of years to complete the transition to a new team. His editorial approach was to specifically seek out clinically relevant research that could build the evidence base for everything coming under the categories that were within the journal's scope. And it published some very significant studies in that direction, collaborating with the Fascia Research Society, publishing on topics relevant across manual therapy professions, with a strong emphasis on the biopsychosocial approach. And he also strongly encouraged young researchers to contribute to this growing evidence base. So even though he did such a wide range of things, essentially they were all focused on the same goal of raising the quality bar, pushing towards the validation and professionalization of the practices that he was devoted to, and building a synthesis of available expertise and research to push these professions forward. The same thing applied to his teaching, and it was also in the mid-1990s that he became the first osteopath to be appointed to a public practice on the British National Health Service. And shortly after that, as a senior lecturer in osteopathy and naturopathy at the University of Westminster. Again, this was groundbreaking in terms of the validation and acknowledgement of the profession. And on his retirement from the university in 2005, he was awarded an honorary fellowship for his services to osteopathy. And he continued to travel and to teach all over the world, promoting evidence-informed practice alongside the topics and approaches that he had always been most interested in. And just a sample from those many travels, you see him here with many friends and colleagues with whom he worked, taught, and of course enjoyed some downtime. You see him here with Viola Fryman, you see him here with his tutor from his student days, Dennis Keeley, John Upledger, and many other faces I'm sure you'll recognize. Tom Myers here, Robert Schleip, Mary Love, Handspring Books, and many more. Beyond everything else he did, he was very much an active member of our family, and I was often puzzled growing up to see him getting the rock star treatment, which incidentally actually always embarrassed him, especially because for me, that was just my funny, kind, strong father who everybody wanted to talk to. My parents were happily married for 47 years, and it is absolutely true that he would never have achieved any of what he did achieve without my mother's endless love and support. She got him to start writing back in the late 1970s. She advised him on many decisions. She saved his life when his health took some serious blows over the years, and she really was the love and light of his life. As for me, well, all I will say is that he was my very best friend, and that we were so like each other in personality, we used to finish each other's sentences. And it was over 10 years ago, when I was beginning my PhD, that I said to him that I wanted to write a history of the osteopathic family, starting with the roots of the techniques that Stanley Leaf essentially consolidated, and recording his own achievements in the context of that whole evolution. He laughed. He absolutely forbade me from doing it, and he told me that I could only do it when he was dead. And he also told me while he was working on the revision of one of his books that when he had gone, they were going to be my problem. And so that is what has happened. So here I am, and I'll say a little bit more about how I'm continuing aspects of his work at the end, but I'm not here to tell sentimental stories. I'm here to talk about his thoughts on his work. So I'm going to start the story at the end. This is the last book he was able to finish, having already fallen seriously ill, and I proofread it for him with the help of the publishers. He did not live to see it in print. I've added the table of contents just to give an illustration of what I mean regarding the diversity of approaches that he would incorporate in his books. And he was incredibly proud of this book because, in a way, it brought him and his work full circle from where he'd begun. He was always fascinated by fascia. And I know this has been a topic of conversation at this conference. And my father would have agreed, in fact, on several points regarding the degree to which perhaps its role has been overstated in several contexts. But my father had a way of cutting through all of that because his interest in fascia had a very specific point of origin and focus. He was writing about fascia in the 1980s, convinced that understanding it would lead to clarifications of osteopathic techniques. And he wrote of the relationship of muscle, fascia, and connective tissue in general to effective functionality, and how dysfunction in soft tissue mirrored deeper pathologies. Specifically, again, writing in the 1980s, he had noted this with relation to various reflex systems, neurolymphatic reflexes, and tender points. And he sought out the earliest fascia research to understand it further, which eventually led to his collaboration in the founding of the Fascia Research Society, his central role in the fascia research congresses supported by the Journal of Bodywork and Movement Therapies, and his input especially on the emphasis of translational research in the context of the FRC. Seeking to promote research, to foster research that could have applicable clinical use and that could provide explanations and clarifications regarding soft tissue techniques. So it really was from the earliest days of his career that he'd been looking for the explanations of how fascia, soft tissue techniques, and osteopathic principles were connected. And the work done through these channels provided that. So the book really is a culmination of all that he'd been looking for throughout his 50-year career, drawing on the most current clinically relevant evidence, specifically with a focus on hands-on practice. And here you see a slide from a 2016 presentation he gave for the British College of Osteopathic Medicine. So this and several other slides I'll be showing you are actually his. And as I said, his approach was extremely pragmatic. My father was never convinced by bold claims, fancy statements, or patented methods. He thought that all of that did far more damage than good. And he always wanted to drill down to the basics. What was the science telling us? How was it relevant? How could it be used? And what needed to go in terms of modalities and techniques, or be questioned? And that's precisely what he set out to explain in this part of his presentation. In terms of basic science and the slides that preceded this one, he was referring to mechanotransduction, fascial adaptation to physical manipulation, the structural, functional, and mechanical interactions between fibroblasts and the extracellular matrix, endogenous compounds, cellular growth factors promoting homeostasis and healing, the role and response of fibroblasts, myoblasts, and thus their action on physical repair processes, the behavior and remodeling capacity of collagen fibrils, and the effect of tension and its unloading, potentially through various manual therapy approaches, on a number of factors and particularly fluid effects. All of this he thus presented, accompanied by the most recent research, and his objective really was to provide a brief overview of the current basic science and clinical evidence relative to fascial self-regulation, as well as thoughts on the more subtle factors involved, such as the optimal degree, type, duration, direction, amplitude, velocity, frequency, and so on of applied therapeutic load, as you see in the last bullet point, all aimed at influencing self-regulating fascial adaptive changes. And while this may not change, as he says here, what osteopaths actually do, apart from confirming certain points that may have experientially offered good results, but that had not been satisfactorily explained, they also allowed an awareness that could bring a more subtle approach and a deeper understanding of what osteopaths are actually doing with their hands. So in terms of how fascia matters to osteopathy, for my father, it mattered as far as evidence-based practice is concerned, as far as potentially new and useful research directions were concerned, explaining mechanisms, confirming and disconfirming them, and particularly now that manual therapy has come under close debate, and there are disputes regarding its usefulness, providing a significant source of information regarding the most subtle aspects of hands-on work. And I will touch on some of the other dimensions a little later. So I started at the end, but this is where that journey had begun. And in fact, it began earlier with his, when he was still training with Stanley Leaf and the rest of the family. This is one of his earliest textbooks, his 11th already in 1985, and this is its third edition from 1985. And as you see here, these are more, this is what he was already saying in this period. He introduces neuromuscular technique as developed by Stanley Leaf, and which eventually became to be known as European neuromuscular technique, focusing on connective tissue. I will say more about it later, but for those who are unfamiliar, it is essentially a very gentle system of both assessment and treatment, relying strongly on palpation and very subtle use of hands-on treatments. And it addresses, as you see, a broad variety of issues, always with the aim of supporting adaptational overload, reducing stresses, and improving function. And one of the key points that Stanley had already begun noting, but it was only much later that research emerged to confirm this, it can replace far more sort of invasive manipulative approaches in most cases. And my father amassed a very large collection of research to this effect. And the point was that back in the 1980s, when all of this was still highly theoretical, he argued in this very early book that fascia and connective tissue more broadly was the place to be looking, and the area that needed the research to support what he and his predecessors thought they were doing, but did not yet have the evidence for. And even then, the idea of focusing on soft tissue was being contested. And so he turned towards the idea of fostering and supporting the development of the science in order to reach some kind of consensus on the matter. And focused strongly on this area, he kept exploring, and he had access to the latest research through his editorial work, which really spurred on what he was doing. So that little blue NMT book quickly grew as repeated discoveries and revisions led to it eventually being split into 4 core textbooks and a couple of other spin-offs as well. And this was one of the main ones, and the core focus really remained the same. And this slide is from one of several other courses that he taught on the topic. Again, you see the title here. It's another one from 2016. And one of the reasons that he focused so strongly on muscle energy techniques is because, again, following Stanley Leaf, he had been troubled by the invasive and sometimes risky nature of high velocity, low amplitude adjustments, and was convinced, particularly through his experience with neuromuscular technique, that there were better ways of achieving mobilization and reducing stresses. So this book was just one of several resulting from that exploration. And you see here some of a summary of some of the methods explored in this book. Well, in the rest of the course, he provides slide-by-slide evidence for the effectiveness of muscle energy techniques, often in comparison to high velocity, low amplitude adjustments or other modalities. And then it goes into the practical methods and applications, as well as the wealth of evidence as to its efficacy. And here you see just a few of the variations summarized from the book. Another textbook that emerged from that little blue book from the 1980s was this one, gathering a group of techniques which can be synthesized together with muscle energy techniques, but is sufficiently differentiated so as to stand alone. And these are especially gentle, involving the patient participating and controlling the process far more than the practitioner, who takes the role of far more of a facilitator with a lightest possible touch. And some of the applications that actually highlight the significance of positional release techniques are in the acute context or with particularly delicate patients. So they can reduce hypertonia in pre and post-operative patients, because again, it's about relying on the patient's participation and never going to the point of pain. They can assist with muscle spasm where more direct methods would not be tolerated, reducing tone before stretching tissues after using muscle energy techniques or other techniques. Acute and potentially multiple strains, such as in whiplash injury, as part of any treatment of chronic soft tissue dysfunction and joint restrictions. Also as part of a sequence, which I'll show a little later, of treating trigger points, once again in an integrated form after NMT and before MET, so after neuromuscular technique, before muscle energy technique. And also joint dysfunction where hypertonia is the prime restricting factor. The core of that blue book had, of course, been neuromuscular techniques, a gentle, as I said, non-invasive method of palpation that simultaneously combines both assessment and therapeutic intervention, as developed by Stanley Leaf, refined by Boris, and then Leon. He describes neuromuscular technique as systematically providing information that regarding tissue tone, induration, fibrosity, edema, discrete localized soft tissue changes, areas of altered structure, adhesions, or pain. And the particular quality of neuromuscular technique is the way that during palpation one can switch from assessment to treatment as literally as you go, so as to start the process of normalizing what it uncovers. Now, around the same time as Leaf was developing his techniques in the US, Raymond Nimmo, a chiropractor, and also Janet Travell and David Simons were developing a slightly different version of a very similar concept, driven pretty much for the same reasons that drove my father, because there was this questioning regarding the notion of spinal adjustments and how sufficient they really were to deal with certain kinds of dysfunction and referred pain. And his technique was refined and developed further by Nimmo's student Paul St. John and others, and then Judith Delaney, who studied with St. John and worked for a time with my father. And this approach came to be known as American neuromuscular technique, with slight differentiations, but many similarities too. And my father always thought to incorporate both where possible, guided by what was effective, safe, and as the research base grew, evidence informed. And you see on this treatment slide, on this teaching slide from 2017, just some of the areas for which this book and the course that this slide comes from provide mechanisms, methods, protocol, always supported by the evidence. And the key really to the way that he delivered this, both in writing and his teaching, was always this idea of synthesis, integration, resting on evidence in combination with clinical experience. He had this way of synthesizing these factors to produce something that was useful, but also solidly evidence informed. And central to all of it is palpation. And this was one of his favorite books. You see here the fourth edition published by Handspring in 2016. I can still remember how happy he was when the first edition came out. And it went through several iterations over the years to culminate in this one. There is so much I could say on this alone, because I also worked with him on this book and had attended some of his workshops. And I think it's really summed up in this quote here, where he says that despite a lot of the questioning that there is surrounding palpation and reliability and so on, as he says, it is a difficult skill which you do need to approach as an art, and you can criticize what you felt with your hands once you've learned to do it. But if you start criticizing before you learn to palpate, you never will learn. And so you will never discover the degree to which you could actually be judging the potential of this skill. And he very strongly underlines that skillful palpation and the ability to use subtle and sensitive touch to examine and assess patients remained essential for an accurate interpretation of underlying problems of fascial and muscle dysfunction. But he also emphasized the need for building experience. And so the book is designed to increase awareness of how to palpate and how to understand what is being felt. And it's very encouraging that I've seen, especially in the last 2, 3 years actually, that the evidence base has grown further than ever in this direction. I handled some very sort of well designed papers on this myself in my time at JBMT. And so, although the debates continue regarding palpation, my father would have noted on this point that an honest balance between clinical experience, well developed skills, and the evidence would be a wiser approach than resting solely on what has or has not yet been sufficiently explored. And of course, it is areas such as this that deserve more subtle exploration still. And a further area that he thought every practitioner needed to understand far more about, especially on the basis of holistic principles, and this is across the spectrum of specializations, was the neglected area of breathing pattern disorders and their often extreme effects. He was a victim of this himself. He had spent 2 weeks on a neurology ward with a suspected stroke that never was, only to eventually have a young neurologist perform a hyperventilation challenge, which immediately produced the tonic-clonic spasms that had sent him into hospital in the first place. As soon as his breathing normalized, the symptoms disappeared, and there were absolutely no other findings. And that experience drove him to look far more deeply into breathing pattern disorders to try and understand just how broad their impact could be. And so you see here in the diagram, this is one of his famous diagrams, again from a 2017 presentation to osteopaths. Um, so he summarizes here how breathing pattern disorders can affect practically all physical systems, with a significant psychological impact as well, which then turns it into a vicious circle. And in this, as in all his books, he ensured a broad spectrum of expert contributors, providing a wealth of evidence and calling for these awareness of these patterns across professions. And so here you see again a summary of the effect of the pathophysiology of breathing dysfunction and how each system can be affected. And in fact, in the full presentation from where I've taken this slide, each of these individual points are very clearly analyzed and then have the resources and the citations at the end. So it's possible to actually trace, follow the evidence trail. And this is part of where he demonstrates how these effects can impact every bodily system and cause chaos with attempts at diagnosis. And that was one of the particular problems. That's how often patients like this end up being waved away because there's nothing visibly wrong with them and the tests all come back clear, but yet something really is going on. And frequently enough, all too frequently, in fact, these this issue is what's at play. And so he designed both the book and the courses to help practitioners recognize these things. And obviously there's no time for me to go into more detail, but here is one of many examples of how he would then synthesize approaches from different professional perspectives to speak across professions and provide methods for rehabilitation, whatever one's starting point, regardless of one's background. So you have a physical therapy approach here. He's put the osteopathic approach next to it to demonstrate how one may talk about it a slightly different way, one might approach it a slightly different way, but essentially one then begins to address the whole person and the problem, the underlying problem. And this was typical of how he would communicate across professions, seeking points of similarity side by side rather than the differences. And the other thing is worth noting, in the blue box, you see, these are areas that an osteopath would look at anyway. But when you look at them with the awareness of breathing pattern disorders specifically in mind, they can provide a very different picture of what's going on and allow a far more holistic interpretation than if you are addressing these points without that awareness. And that's where he sought again to synthesize the one with the other. And the previous slides with a breakdown of the pathophysiology and the cycle of dysfunction are also useful for patients to understand the situation and become more mindful of their body, of the potential somatization of distress, whether the cause is physical or otherwise, and thus begin to break the cycle. In this, as in all things, my father saw himself first and foremost as a facilitator. Because, as I said earlier, he took the notion of whole person treatment very, very literally. He took the whole holistic principle of treatment very literally. But in order to serve his key priority, which was the validation and improvement of the profession, ultimately for patients, he went to great lengths to support and encourage and create venues for the necessary research. And he never accepted the argument that the science hasn't caught up, but would only go as far as safety and ethical practice would allow until that science did catch up. And he pushed that science through every channel, through his association with the Fascial Research Society, also insisting, as he did through the journal in his many editorials, on the need for research literacy and the production of research that could actually be clinically applicable. So that was essentially an overview of my father's main thoughts and priorities, particularly in the last 15 years or so. And I can't, in this context, go into any greater depth, nor do I have the expertise to teach his material on a practical level. But the good news is that even though he has gone on that very long journey, you can still learn directly from him. And there is a set of courses, recorded courses, which are actually recordings of him teaching live in New York in 2016. Offered by hands-on seminars. And please be aware, these are the only authorized courses. And if anybody else is out there claiming to be teaching his methods, they are not authorized to use his name. He did not patent his methods, and he did not believe in doing so. The good folk who run hands-on seminars are close colleagues and good friends of my father, who spent literally hundreds of hours learning from him. So if anybody is interested in exploring what he has to say on these methods, and they include theoretical and practical elements, then you can still hear from him directly through this channel. As for me, I'm not a clinician, and I don't pretend to be a clinician. I spent 40 years learning from my father, but ultimately I became an academic. I'm an interdisciplinary historian. I'm a language and communication specialist, and I'm currently researching areas involving the philosophy and the history of science and medicine. And I've also worked in a number of areas, including academic publishing, language arts, communication, matters, and I've been teaching on a variety of these topics for over 20 years. In 2019, Elsevier appointed me series editor of my father's textbooks, and right now, these three are the ones we're working on. And for each, I have selected a new editor or editors from among my father's closest colleagues to handle the clinical side of the revision, while my job is to ensure that the material and the approach remains true to his overall vision, which hopefully I've been able to share with you. So these three books will eventually emerge in their revised editions, as we're working on them now. It'll take some time yet, though. And the other books will also be handled the same way once their turn comes up. So beyond the books, my priorities are essentially the same as my father's in terms of encouraging high quality but useful and clinically relevant research, particularly in contested areas. So one way I'm doing that is through teaching research literacy, critical appraisal skills, and manuscript preparation to MSc physiotherapy students at the University of Patras in Greece, bringing them in touch with key issues and hot topics on the international scene, and helping them avoid pitfalls in their research and manuscript design, highlighting for them which areas deserve and require the greatest attention and what pitfalls have led to low quality evidence being produced thus far in many cases. A second area is my research and writing on narrative medicine. And now this is a relatively new discipline, which is not widely known as yet, perhaps among manual therapists, and it's emerging within the heart of biomedical practice, aiming to address the problems and shortcomings of the biopsychosocial model while making evidence-based practice more effective for the individual patient. And it's a very well researched and rapidly growing biomedical answer to the whole person approach. In the context of manual therapy specifically, it also provides a very necessary counterweight to arguments in favor of hands-off approaches, because the focus of narrative medicine is the empowerment of the patient, and it is far more sensitive to patient needs than the current model promoted through pain science application often allows, or sometimes allows. So narrative medicine is essentially a protocol for practitioner-patient communication, for building the therapeutic alliance with the therapist, largely in the role of facilitator, and patient preference and a holistic approach is what guides the clinical decision-making. And narrative medicine came about through the close collaboration of biomedical specialists with humanities scholars, particularly those specialized in the literary arts. So although I'm not a clinician myself, I am actually a literary scholar. And with regard to this, I'm looking to see how one can mediate, um, especially on this, in this context, in the context of the manual therapy professions, for which it does have profound implications, which I've written about, and some of you will be aware of through my articles in Massage and Bodywork, particularly the last couple of articles, and the next one is on its way. Narrative medicine is based on entirely holistic principles, and one concern I've expressed in my articles is that as biomedicine begins to embrace holistic approaches in education and primary care, the professions whose core principles these are, holism in other words, and especially those which sometimes move a little too close to what some see as fringe or pseudoscientific practice, need to re-examine certain perspectives. And aside from this, I am also researching and exploring and writing on a number of topics, some in the context of postdoctoral research, some in a slightly more independent context, still addressing the areas that my father worked to develop. I'm also in discussion with a significant interprofessional and interdisciplinary consortium that is looking to build bridges between the various manual therapy professions. These are people my father knew and talked to, and this was an idea that he had discussed with them. And I know he would have been absolutely delighted to see it finally flowering. And I hope to be contributing to some of their work in the future. In parallel, I'm also working on an in-depth sociological historical study of the evolution of complementary stroke alternative stroke integrative medicine, with a view to addressing long-held misconceptions among various stakeholders. And lastly, I'm working on the family history because despite everything else, I am still a historian, and surrounding me in this room where you see me are 50 years worth of my father's records, historical books that he collected from the earliest days of osteopathy and naturopathy, and all of his documents. So I hope to eventually bringing that to light. Thank you very much for your attention and for this opportunity, and I'll be delighted to take any questions. Thank you for listening.